Joe Biden shared an emotional message with George Floyd's daughter. The World Health Organization walked back on coronavirus transmission comments. And something, somewhere, is sending Earth unexplained signals from across the universe.
It's Ashley, back with the news you need to know.
But first, a Rhode Island love story that will break your heart. These sweethearts, together for 82 years, died days apart from the coronavirus. Heartbreak.
The Shortlist newsletter is a snappy USA Today news roundup. Subscribe here.
George Floyd's 6-year-old daughter Gianna misses the bare hugs that only Floyd could give, the joy of riding on his shoulders, the countless hours they spent playing games. Gianna recently told former Vice President Joe Biden the many things she missed about her dad, who recounted the wrenching conversation in a video message delivered during Tuesday's funeral for the man who died in police custody last month. She also asked Biden why Floyd had to die. No child should have to ask questions that too many black children have asked for generations. Why? Biden said, "Now is the time for racial justice. That's the answer we must give to our children when they ask why." Relatives and elected leaders spoke passionately at Floyd's funeral, demanding reforms and justice for a black man whose death has shaken the world.
Remember when the World Health Organization suggested COVID-19 transmission by asymptomatic individuals is very rare? They're taking that back. An official leading WHO's coronavirus response clarified comments made at a media briefing on Monday, saying the remarks were referring to a small subset of studies and unpublished information from member states. "I used the phrase, very rare, and I think that's a misunderstanding to state that asymptomatic transmission globally is very rare," said Dr. Maria Van Kerkhove, WHO's technical lead. In contact tracing efforts from other countries, secondary transmission from asymptomatic individuals was rarely found, she said, but the subject is still a major unknown.
"There's nothing this astronaut can't do. Convince me otherwise, I dare you." The first American woman to walk in space just added another first to her list of badass accomplishments. She is now also the first woman to reach the deepest point in the ocean. Former NASA astronaut Catherine D. Sullivan, an oceanographer and veteran of 3 space shuttle flights, is the first person to achieve both feats. What did Sullivan do to celebrate her nearly 7-mile dive to Challenger Deep in the Mariana Trench? She called her astronaut buddies at the International Space Station, obviously. Only 8 people have reached the bottom of Challenger Deep.
A 2.7 magnitude earthquake rattled portions of Northern California on Tuesday, according to the U.S. Geological Survey. The quake, centered near the campus of the University of California, Berkeley, occurred along the Hayward Fault. That fault is a little sketchy. The U.S. Geological Survey considers it to be one of the most dangerous in the world.
Cristobal is the storm that just won't quit. The remnants of what was Tropical Storm Cristobal slammed portions of the Midwest on Tuesday, unleashing downpours and gusty winds. What's left of Cristobal, now a tropical depression, is expected to become a powerhouse storm over the Great Lakes on Wednesday.
The short list is featuring stories from healthcare workers on the front lines in the fight against COVID-19. We want to hear your story. Email me at ashley@usatoday.com.
Who would have thought when I started my nursing career 39 years ago that I would be facing a pandemic outbreak with no vaccine or cure at present? I have spent most of my career in cancer care and hospice, palliative care, and often have to have difficult conversations with patients and families about end-of-life decisions. Having cancer myself and currently under treatment, I tried to work from my office to minimize my risks, but it was impossible to have those conversations by phone. I take precautions, but I do meet with my patients who have been forced to endure hospitalization without the support from their family. No visitors are allowed. Their isolation is palpable. I am forced to have phone conversations with family members who understandably have difficulty coming to terms when treatments are no longer working. COVID-19 has stolen part of the essence of what being a good nurse means to me, face-to-face interactions with patients and their families to establish that human connection.
Lisa Doms, RN, CHPN from Maui, Hawaii.
This is a compilation of stories from across the USA Today network. Want this news roundup in your inbox every night? Sign up for the Short List newsletter here.